The second trial presented today was the SPIRE trial, SPIRE 1 and 2. Now this is another PCSK9 inhibitor, which is not an all-human monoclonal antibody. And what happened was that the patients had reactions to this PCSK9 inhibitor, which had a murine component as part of the antibody. So that drug has been taken off the market. So we know now that the all-human monoclonal antibodies, such as those used in the Fourier trial and also the one that's going to be used, that's being used in Odyssey, appear to be safe, and the patients don't have any reactions to them. The SPIRE trial was discontinued. Now I think it was very important that this trial was presented publicly as it was. In many instances, the trial will sort of be stopped, and by rumor you find out what happened. Not so with SPIRE 1 and 2. It was reported. There was a discussion about why the medication did not work, and we learned some important things from it. The SPIRE 1 trial actually had patients at a lower risk, around 3.1, 3.2% annual risk. Remember, Fourier was up at 5% and showed a benefit. These patients, at least for a small amount of follow-up, did not appear to benefit. However, SPIRE 2, whose patients had LDLs that were up above, much higher, above 100, treated with maximal statin therapy, did show a benefit. So this is more evidence from SPIRE 2 that it's the high-risk patient, not every patient, the high-risk patient who's had maximal treatment with intensive statin therapy that's likely to benefit from the addition of PCSK9 inhibitors. What we need to do now is to follow these treatments out a little bit later, say up to 4 years, and see if there is, in fact, further reduction, further improvement of outcomes, so that we'll have a number needed to treat, NNT, that is where we want to be for cost effectiveness. We'll also get additional information about safety. Right now, the medications appear to be safe. There were no side effects that were patient safety related in the SPIRE trials, but they did have the reaction to the antibody that impaired the cholesterol lowering. So the PCSK9 inhibitor, which is a non-all-human monoclonal antibody, has not worked and is taken off the market.